Hi there, welcome to the program Your Doctor and COVID. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital. Thank you for joining us, and if you have any questions, send them by WhatsApp to 620-MASK, that's 620-6275, or you can send an email to docandcovid@gmail.com. That's all lowercase, docandcovid@gmail.com. Today, as usual, you see me here wearing my mask, and I want to demonstrate the correct way of wearing the mask. Make sure it covers both your nose and your mouth, not under the nose and definitely not under the chin. This is useless and puts you and those around you at greater risk. So I will take this off for today because no one else is with me right now, so I pose no risk to them and no one else is here to pose a risk to me. So we start off today by looking at questions that were sent in by our viewers or listeners. And the first question, a very important one, very practical indeed. And here is the question. If a teacher tests positive for COVID-19, but she is not sick, can she go back to work? That is the first question. And then the second question from someone else is, the virus is mutating. If a person is infected with one strain, can they be reinfected with another strain? As you can tell, the questions are getting harder and the answers are probably going to be a little bit more technical, but we will try to make sure that everyone can understand and at least come away after this program knowing a little bit more about this problem. So let's look at first the issue with the teacher. And essentially we're using guidelines from CDC and the WHO. In general, the more closely you interact with others and the longer that interaction, the higher the risk of COVID-19 spread. Essentially, more than 15 minutes in the presence of someone who is COVID positive and you not wearing personal protective equipment, that puts you at the highest risk. If you return to work, continue to protect yourself by practicing everyday preventive actions. And these we have talked about several times, like hand washing, social distancing, and wearing of masks. These are the items you should keep on hand when returning to work: a mask, tissues, and hand sanitizer with at least a 70% alcohol base if possible. So here are some questions that people may ask themselves. I think or know I had COVID-19 and I had symptoms. How does this person deal with returning to work or returning to others? A person like this can be with others if they were at least 10 days since the symptoms first appeared and at least 24 hours with no fever or without having to use any fever-reducing medication like Panadol. As well as there are no other symptoms of COVID-19 or if there are symptoms, they are actually improving. One thing to remember, loss of taste and smell may persist for weeks or months after recovery and need not delay the period of isolation. So loss of taste and smell does not necessarily mean that you still have active disease and should stay away. You can actually have that and return to society. So here's another question or a scenario that may cross your mind, or some patients may have this question. I tested positive for COVID-19 but had no symptoms. In a scenario like this, if you continue to have no symptoms, you can be with others after 10 days have passed since the date you had your positive results. So if you had your positive result, no symptoms, you've waited 10 days, and you still have no symptoms, you can rejoin society or rejoin work. If a person tests positive for COVID-19 and they have a weakened immune system, this is another scenario, a positive test with a weakened immune system. What are the recommendations? If you have a weakened immune system, or if you're immunocompromised due to a health condition or medication, you might need to stay home and isolate for longer than 10 days. If testing is available in your community, your healthcare provider may recommend you undergo repeat testing for COVID-19. If your healthcare provider recommends testing, you can be with others after you receive 2 negative results in a row, at least 24 hours apart. So back to the first question. If a teacher is sick or tested positive for COVID-19 rather, but she is not sick, she's positive but not sick, as long as that 10-day period would have passed, it is safe for that teacher to re-enter the workforce or to re-enter the society. There are some times where persons will be coming in contact with a lot more individuals, and in those situations where they would have had symptoms and then it resolved, the WHO would have recommended the 10 days plus an additional 3 where you're completely symptom-free before you're actually able to rejoin the workforce. Okay, so that is the first question as it relates to the teacher. Now the second question that we looked at, or we're going to look at, is the mutating virus. And the question is asked here that the virus is mutating. If a person is infected with one strain, can they be reinfected with another strain? Interesting, very interesting question. Coronaviruses are named for crown-like spikes on their surface. These spikes actually allow them to attach to human cells and invade those cells. There are 4 main subgroupings of coronaviruses known as alpha, beta, gamma, and delta. At least 8 strains, that's 8 strains of coronaviruses are circulating the world. Over 2,000 genetic sequences of the virus revealed that it is mutating on average every 15 days, so that every 2 weeks the virus is mutating. According to researchers, the virus is mutating so slowly that its strains are fundamentally very similar to others. It is not clear if these mutations are affecting the virulence, meaning how strong the virus is, or how much more damage it can cause. So these spike proteins on the surface of the virus, if you think about Velcro, where one part is used to stick onto another part, that's what these spike proteins are. And when the virus mutates, what it does is that these spike proteins are changing so that the stickiness basically becomes a lot more effective. So how are reinfections determined? What is a COVID-19 reinfection? When a patient tests positive for SARS-CoV-19, less than 3 months after onset of symptoms, the test could represent a new infection. Recovered patients can still have non-infectious viral particles in their bodies that show up as positive results in PCR tests. If a positive test occurs more than 3 months after a person's symptom onset, there is a possibility of reinfection. So if you would have had it and you still 3 months after test positive, there is a possibility that that represents a reinfection. Right? So how do we actually establish reinfection? This is determining a very challenging issue. Scientists have to use genetic sequencing and match entire pieces of the virus to be able to make this determination. There are subtle differences in the genetic material of different strains of COVID-19. If differences show up during genetic sequencing, then you may make a conclusion that this is a reinfected case. Now, reinfection can occur, and it has occurred, but it is a very, very rare phenomenon. So even though it is possible, it is quite rare. It is so rare that we actually know where these cases are almost all around the world. Recently, Hong Kong reported its first case. India's first COVID-19 reinfection cases were reported a couple weeks ago when 2 nurses from a particular hospital were confirmed using genetic testing. Hong Kong's first case was reported in a 33-year-old man, and since then it has basically reached the Western Hemisphere. Cases have since been reported in Nevada, in the US, Belgium, Ecuador, and 4 healthcare workers in Mumbai, in India, have been confirmed to have reinfection. What is our scenario in Guyana? We have a suspicion that we have had at least 1 reinfection in a patient who is in Region 1. But as you can tell, these cases are rare, they do not happen very often, and so rare that you could actually count them on your fingers. So the answer to reinfection, it's possible, but it is quite rare. Unfortunately, one of the reinfected patients in one of our overseas territories, that patient would have recently died. And I believe it's the first reported case where a reinfected patient got sick again and died. So we believe, because of the similarities of the various strains that are in existence for the coronavirus, they tend to produce a very similar antibody and immune response in the host or the patient. And because of that, when a new infection may present itself, the antibodies or the immune system recognizes the problem because it has been awakened or produced from the first infection, and then it will therefore be able to fight in the second infection. This is very similar to the way that vaccines work, where your immune system is basically woken up and say, hey, this is a potential infected particle that you will encounter. Please prepare your immune system. Please prepare your soldiers to fight off this infection. So again, to answer this particular question about mutation and reinfection, it is possible, but it is extremely rare. Nothing actually prevents it more than the simple measures that we've talked about all along, which is social distancing, hand washing, and wearing of masks, especially when you are going to be out in public or in social circles that you are not normally part of. Thank you, and I hope this answers your questions.